Hi, everyone. Welcome to the Oregon Immunization Programs training on immunization law in Oregon schools and children's facilities. My name is Kelly Gano, and I work as part of the school law team here at the Oregon Immunization Program. You can email our team at oregon.imm@odhsoha.oregon.gov if you have questions that come up during the training, or if you'd like to request this training in a different format. This training is for sites that fill out their report forms by hand on our website. If you use the student information system to complete your reports, please watch the other training. This is a series of trainings that cover the immunization review process in 3 parts: requirements, alert IIS, and reports. This is part 1, requirements. I'm going to begin by addressing a common question we get asked about childcare programs in schools, which is, why do we need to report at all? Fact is that schools and childcares are at an increased risk of spreading disease because of the close interactions that occur on a day-to-day basis. You are the only people who know who is gathering together in your space. So this work of letting parents know about missing vaccines is important as part of caring for children so that they can stay healthy. Where are immunizations required in Oregon? Immunizations are required in schools, both public and private. They are also required in children's facilities, such as preschools, Head Starts, and certified child care programs. What records do you need to collect? Immunization records, non-medical exemptions, medical exemptions, and immunity documentation. Who do you need to collect immunization records for? Every child in your program, but there are some exceptions. Exceptions are children who attend fewer than 5 days per school year and children who are counted by another site, such as children who attend school during the day and an after-school program after school would only be counted by the school. A frequently asked question that we often get is, what if I have fewer than 10 children? If you have fewer than 10 children, you still need to collect immunization records for every child in your program. Another question we get asked a lot is, what if I have online students? If your online students are coming in person to participate in activities, then you need to collect immunization records for those students. If your online school has only online students and they never come in for any purpose, then you do not need to collect immunization records. When do you need the immunization records? Before a child starts attending your program. There are some exceptions, which include transfer students and houseless students. The McKinney-Vento Act covers houseless students and requires that you enroll them immediately in school. The enrolling school shall immediately refer the parent or guardian of the student to the school district houseless student liaison, who shall assist in obtaining necessary immunizations or screenings, or immunization or other required health records. The enrolling school staff shall make every effort to help the family compile an immunization record for the student, including requesting a record from a previous school, alert IIS, or a previous medical provider. What do you need on a new enterer's record? A record showing at least 1 dose of each required vaccine for the child's age, or an exemption. What records are required? All shot dates must be on one of the following: the Certificate of Immunization Status Form, also known as the CIS form, or as part of an Alert Immunization Information or IIS printout. What do you do with records from another state or country? If you're not able to read or interpret a record that is not from this state or country, you can reach out to your local health department for assistance. This is the front of the Certificate of Immunization Status Form, or CIS. There's a place to put the child's last name, first name, middle name, and birth date, as well as the parents' or guardians' names and a good telephone number. There's also spaces to write the dates the child received all of the school-required vaccines, and a place at the bottom to sign. This is the back of the CIS form. There is another space to put the child's last name, first name, middle name, and birth date. There are also spaces to put other vaccines received, medical exemptions, and any immunity documentation. Finally, at the bottom, there's a section to fill out if you're looking to receive a non-medical exemption for your child for one or more vaccines, and a place to sign. If you're looking for your child to get a non-medical exemption, there are two documents that you need to provide the school. The first is the CIS form with the non-medical exemption portion filled out and signed. The second is the Oregon Vaccine Education Certificate from either the online module or a healthcare practitioner. The address on your screen is how you can be directed to the online module where you can watch it in one of three languages, English, Spanish, or Russian. It also has the form if you're looking to get that done by a healthcare practitioner instead. A frequently asked question is, do parents have to do the non-medical exemption every year? And the answer is no. This paperwork is good once it's done until the child turns 18 or graduates high school. So there's no need to do it again every year. You will, however, likely have to re-provide it to a school if the child transfers or moves to middle school, high school, that sort of thing. This is the form to obtain a medical exemption. This form must be signed by a physician and must list a specific medical reason. This medical reason must be a contraindication or precaution to vaccination per the Center for Disease Control and Prevention or the American Academy of Pediatrics. True medical exemptions are fairly rare. Only about 0.1% of Oregon students have one. When in doubt, accept the medical exemption paperwork, but make sure you send the form to the health department with your immunization reports. Once an exemption has been determined by the health department to be permanent, it does not need to be reviewed again. Immunity documentation. This is used when a child has had the disease or has blood test results showing immunity. Children with immunity documentation should be counted as complete for that vaccine. Immunity documentation must be signed by a physician, be a lab report, or show immunity from Alert IIS. Here are a couple of fall activities that you should perform in order to make sure that you have the most complete immunization record for each child in your care. The first is reviewing all records for every student, and the second is notifying parents or guardians if immunization records are incomplete. This can help get you up to date and have all your records be complete so that by the time that you're reporting in January, you have everything that you need to successfully report. How do you assess an immunization record? Immunization dates can be assessed using an approved computer system, the primary review table, or Alert IIS. Here are some tips on how to be successful and efficient when collecting immunization records. The first is collect records at enrollment. You can also use Alert IIS. Find tools that best fit your school or childcare. Know your due dates and notify parents and guardians early and often. This is a page showing the law that this is all based on for schools, children's facilities, and colleges. The first set is the Oregon Revised Statute 433.235 through 433.284, disease controls in schools. The second are the newly revised Oregon Administrative Rules dealing with school immunizations, 333-050-0210 through 333-050-0410. Here is the contact information for the Oregon Immunization Program's school law team and a link to the reporting packet. Thank you for attending this training. For immunization forms, go to www.healthoregon.org/school packet. If you have questions about immunization records, you can contact your local health department or the Oregon Immunization Program's school law team at oregon.imm@dhsoha.oregon.gov.